Primary hyperoxaluria is a rare genetic disorder that causes the body to produce too much oxalate, leading to kidney stones and organ damage. This video will explain its genetic basis, types, clinical manifestations, diagnosis, management, complications, ongoing research, and long-term outcomes. Primary hyperoxaluria is a genetically inherited disorder that is caused by mutations in specific genes involved in oxalate metabolism. The precise genes implicated in primary hyperoxaluria can vary depending on the type of the condition, with type 1, type 2, and type 3 being the most well-known types. Inheritance patterns in primary hyperoxaluria can follow either an autosomal recessive or autosomal dominant pattern, depending on the specific gene mutations involved. Oxalate is produced in the body through various metabolic pathways, such as the glyoxylate pathway and the hydroxyproline pathway. In individuals with primary hyperoxaluria, there are disturbances in these pathways, leading to increased oxalate production and impaired regulation. The dysregulation of oxalate metabolism can result in the accumulation of oxalate in the kidneys and other organs, contributing to the development of complications. Primary hyperoxaluria is classified into different types based on the specific biochemical defects that underlie each type. Type 1 primary hyperoxaluria is characterized by a deficiency of the enzyme alanine glyoxylate aminotransferase. Type 2 is caused by a deficiency of the enzyme glyoxylate reductase/hydroxypyruvate reductase, and type 3 is caused by a deficiency of the enzyme 4-hydroxy-2-oxoglutarate aldolase. Each type has distinct clinical implications and varies in terms of severity and prognosis. Primary hyperoxaluria can present with a wide range of clinical manifestations, primarily affecting the kidneys and urinary tract. Common presentations include recurrent kidney stones, pain in the flank or abdomen, blood in the urine, and urinary tract infections. However, primary hyperoxaluria can also affect other organ systems, leading to systemic complications such as cardiovascular abnormalities, bone disease, and vision problems. Diagnosing primary hyperoxaluria involves a combination of clinical evaluation, laboratory tests, and imaging studies. Genetic testing plays a crucial role in confirming the diagnosis and identifying the specific gene mutations involved. Urine analysis, including the measurement of oxalate excretion, is also an important diagnostic modality. Additionally, imaging studies such as ultrasound, CT scan, or MRI may be used to detect the presence of kidney stones or assess the extent of organ involvement. There are several risk factors and triggers that contribute to the development of complications in individuals with primary hyperoxaluria. These include dietary factors such as high oxalate intake, dehydration, gastrointestinal disorders that affect oxalate absorption, and other medical conditions such as inflammatory bowel disease. The identification and management of these risk factors are crucial in preventing the progression of primary hyperoxaluria and reducing the risk of complications. The management of primary hyperoxaluria involves a multimodal approach aimed at reducing oxalate production, enhancing oxalate excretion, and preventing the formation of kidney stones. Medical therapies may include the use of medications such as pyridoxine, citrate, or potassium supplementation. Dietary interventions focus on reducing dietary oxalate intake and maintaining adequate fluid intake. In certain cases, surgical options such as lithotripsy or kidney transplantation may be considered. Primary hyperoxaluria can lead to the development of various renal manifestations and complications. Nephrocalcinosis, the deposition of calcium oxalate crystals in the renal tubules, is a common complication and can contribute to impaired kidney function. Over time, the progression of primary hyperoxaluria can lead to end-stage renal disease, necessitating renal replacement therapy such as dialysis or kidney transplantation. While primary hyperoxaluria primarily affects the kidneys, it can also lead to extrarenal manifestations and complications. Systemic oxalosis occurs when oxalate crystals deposit in various organs outside of the urinary system, such as the heart, bones, eyes, and blood vessels. Urolithiasis, the formation of kidney stones, can also occur in individuals with primary hyperoxaluria and can contribute to urinary tract obstruction and infection. The management of primary hyperoxaluria presents unique challenges, particularly when dealing with pediatric and adult patients. In pediatric patients, early diagnosis is crucial to prevent the development of complications and preserve kidney function. Management strategies may need to be adapted to accommodate the growth and development of children. In adult patients, the management of primary hyperoxaluria often involves addressing existing complications and optimizing renal function while considering other comorbid conditions. The field of primary hyperoxaluria is evolving, with ongoing research focused on novel treatment approaches. Enzyme replacement therapy, which involves supplementing the deficient enzyme in individuals with primary hyperoxaluria, shows promise in reducing oxalate accumulation and preventing complications. Gene therapy, aimed at correcting the underlying genetic mutations, is another emerging treatment modality. Additionally, clinical trials investigating new pharmacological agents and dietary interventions are underway, offering hope for improved management strategies in the future. The prognosis and long-term outcomes for patients with primary hyperoxaluria can vary depending on several factors, such as the specific type of primary hyperoxaluria, the age of onset, the timely diagnosis, and the effectiveness of management strategies. Early diagnosis and appropriate management are crucial in preventing the progression of the disease and reducing the risk of complications. The development of end-stage renal disease is a significant concern, and long-term follow-up is necessary to monitor kidney function and manage associated complications. Primary hyperoxaluria is a complex genetic disorder causing oxalate overproduction and accumulation. Understanding its genetic basis, pathways, manifestations, diagnosis, management, and outcomes is crucial. Ongoing research offers promise for better patient outcomes. Future healthcare professionals must comprehend this rare condition for optimal patient care.